This PowerPoint is for the RQF BTEC Level 3 in Health and Social Care. This is Unit 7, Principles of Safe Practice in Health and Social Care, and it focuses on Learning Aim D, exploring procedures and responsibilities to maintain health and safety and respond to accidents and emergencies in health and social care settings. I will now discuss procedures to maintain health and safety. Infection control and prevention. Infections are caused by pathogens, which are microbes that infect your body. A contagious disease is one that's transmitted by physical contact with someone that has that disease. An infectious disease can be transmitted by air, water, even mosquito. As a health and social care worker, you should make sure that your vaccinations are always up to date. At present with COVID-19, that they are ensuring that all carers and first responders like nurses and doctors are being vaccinated with the COVID vaccine as priority. If you are unwell with a cold, you could expose your service user who may be sick, frail or vulnerable to your disease. So it's really important that if you are unwell, you do not go into work. You should be meticulous with your hygiene when working with service users. You should be aware of the correct way to wash your hands, any PPE, so personal protection that's required, so that you do not put your service users at risk. Due to COVID-19, we're fully aware of the correct procedures for hand washing. The Prime Minister Boris Johnson suggests singing happy birthday to ensure, I think it's happy birthday twice, to ensure that we are cleaning our hands for 2 minutes. So we have a look here. It says, first of all, rub hands palm to palm once you've put the soap on. Right hand over left hand with interlaced fingers to make sure that you clean in between those fingers. Palm to palm with fingers interlaced, backs of fingers to opposing palms with fingers interlocked. Rotational rubbing of left thumb clasped in right and vice versa. And rotational rubbing backwards and forwards with clasped fingers of right hand in left palm and vice versa. This is how thorough they expect you to wash your hands when you work in health and social care. It's also really beneficial at the moment that if everyone cleaned their hands and washed their hands this thorough, it would help prevent the spread of COVID-19. Safe moving and handling of equipment. It's really, really important in health and social care that you do not lift or carry incorrectly, because it could mean that you get a back injury and you are unable to work. So there are basic checks that you should carry out before lifting. If it's heavy, lift it as a team. Turn using your legs. Do use your legs. For example, if you're picking up an item that is heavy, either by yourself or as a team, and it's a load, say for example, you think you could manage in a pair or you could manage alone, you should always bend your knees, not your back, to pick up the parcel. Always bend your knees, stoop down to the height, and then slowly straighten your legs. And if possible, always use equipment such as a trolley to help you actually get that parcel from A to B, or a piece of equipment from A to B, without placing any extra pressure on your own body. If you have a look at the diagram below, you can see the damage that it can do to your back if you are not lifting and carrying properly. Food preparation and storage. It's vital that food is stored and prepared correctly and safely. For food preparation, you must keep cooking surfaces clean and always wash your hands before preparing food for your service users. You need to make sure you do things like cleaning down the surfaces, make sure that meat cannot be touched, wash your hands before you handle food that does not need to be cooked. It's also really important that if you are working with food, you've undertaken a basic food hygiene certificate. Raw meat can contain a range of bacteria that can cause serious illnesses. If your service user is already frail or has existing health conditions, then contracting food poisoning can have very serious implications. You could imagine if food poisoning occurred in an elderly residential care home, that could be serious. It could have serious consequences on those who are already elderly and perhaps feeling unwell. You must check the use-by dates on food you serve to your service users, and you should tie long hair back and keep nails short. Any long nails, so if you have loads of false nails, lots of dirt and bacteria can get underneath them. Any cuts on your hands should be properly covered. And if you're preparing food and you cut yourself, a blue plaster should be placed immediately onto that cut. It's really important that you have the food preparation plasters because they're easy to spot if they fall off and go into food. Food preparation continued. You should heat food to the correct temperature. When reheating food, follow the microwave guidance, as there's some food that should not be reheated. Food must be covered until it's served and eaten. Food storage. Fridges must be set at the correct temperature, between 3 degrees and 5 degrees, in order that the food is safe, but for nutrients not to be lost as well. Reheated food cannot be refrozen and must be thrown away. Try to get to know your service users' dietary requirements so you can avoid excessive wastage. Check that the freezer is properly maintained, as a build-up of ice can mean the freezer door won't shut properly, and the freezer will defrost and the food could be spoiled. It's important that you store food in the correct packaging and that food is taken out of its original packaging. Any food that's taken out of its original packaging is labelled and dated, so you know when to get rid of it. Storage and administration of medication. Legislation covering the receipt, storage and administration of medication includes the Care Standards Act 2000, Health and Social Care Act 2008, Health Act 2006, Medicines Act 1968, Misuse of Drugs Act 1971. Individuals should be encouraged to self-medicate where possible. In care settings and in situations where individuals cannot self-medicate, medication should be stored centrally in hygienic and secure conditions. The keys to the medicine storage facilities should not be part of a master key system, so they should be separate. Medication should only be administered by individuals who are trained and qualified to do so. Nobody else has the right to hand that out. That's very important. Health and social care settings that require people to be medicated should provide facilities that are large enough to contain the maximum amount of medicines expected to be used. Poorly organised cupboards can lead to errors being made. All medicines should be labelled with the following information: the service user's name, name of the medicine, the dosage amounts for administration, whether it needs to be taken with food, expiry date, the pharmacist's name, and warnings about any specific side effects that it may cause. For example, does it cause drowsiness, sickness? And a record must be kept of any medication administered to any patient to reduce the risk of an overdose. It's so important that you sign off if you have handed it out. Otherwise, somebody else could come along later and go, oh, it hasn't been handed out, gives it to them, and they could end up very ill. Now I'm going to discuss the storage and disposal of hazardous substances. COSH applies to virtually all substances considered hazardous to health. However, there are certain exclusions, including lead, asbestos, radioactive materials, and substances considered hazardous to health, but administered by a qualified medical practitioner, such as a doctor, covered by the Medicines Act. Medicines should be stored in accordance to the setting policies and procedures and kept in the original packaging. If we look at the moment with COVID-19, there is a particular vaccine that needs to be kept at a particular temperature to be effective. Cleaning materials and instructions need to be followed. For example, how to dilute cleaning liquids. You should ensure that you're disposing of things properly, like dressings and needles, and they're not just put into a regular bin, especially something like a needle. If you put a needle into a black bin bag, the person then collecting that black bin bag could be at risk of contamination. Procedures for responding to accidents and emergencies. First aiders can deal with minor injuries and accidents. Most workplaces will have a first aider in place. In major injuries and accidents, ring 999 and listen to your instructions and answer questions to the best of your ability. For example, if you have a person that's collapsed holding their heart, they will ask you questions about them. Should they stop breathing, they will guide you on how to carry out CPR. In your workplace, you need to let your employer know if you're allergic to anything, because if you're expected to work with a particular material that you're allergic to, it could have a negative and a detrimental impact on your health. To avoid back pain, ensure that you're following the manual handling guidance, which we discussed earlier. So making sure you bend your knees and that you're not bending your back, for example. If you feel stressed or overwhelmed, seek help before the situation reaches crisis point. That's vital. Always ask for help when you need it. Finally, the last slide that we'll go through is fire safety, evacuation and security procedures. It's really important you have a quick look on Google and you Google in fire procedures for a particular care home local to you, for example, to see the way in which they would deal with a fire that occurred in their setting. The Regulatory Reform Fire Safety Order 2005 requires a managed risk approach to fire safety. This means that the management of the premises providing care must take reasonable steps to reduce the risk from fire. And if there is a fire, they need to make sure people escape safely. So there needs to be, well, in all health and social care settings, there is like a muster station. So somewhere where you would go to, a fire evacuation point where you would stand, you'd all go to make sure you're safe, be checked off on a register, where it's away from a burning building. Now, with residential care homes for the elderly, especially nursing homes where they're unable to get the elderly residents out, they may be on a particular floor, or it may be that they're unable to walk bedbound. There are fire doors. A lot of these places have fire doors in place so that they can actually make sure the fire doors are shut and leave the elderly residents in there, because the fire doors can take hours to burn through. By that time, hopefully the fire brigade should have got in and got them out. So there are strategies that these places have to ensure the safety of the residents or people within their care. But a responsible person should draw up a fire policy, which should include how to minimise fire risks. It's really important that all fire risks are minimised, and how to provide and maintain firefighting equipment such as extinguishers. They must plan escape routes, how they're going to get people out, and ensure that training is provided on this. So if there is a fire, everyone's not flapping and going, I don't know what I'm doing. They all know the procedures to get as many people out as well as themselves from the building. But have a look at some of the different fire procedures that settings have in place. They all vary from place to place.